Yes, friends, welcome guys to Mrs. B Talks Health and Wellness. This is going to be a series of various videos because there's so much aspects to health and wellness. And health and wellness for me, I mean for everyone, it's like, you know, your emotional health, your mental health, your financial health, and of course your physical health, which is what I'm going to start with today. Which all of these type is actually needed for your overall well-being and survival. You know, everything I mentioned is needed for overall health of your body and survival, physical health, well, emotional, and survival. I always take, like, you know, I'm always a big deal on basically all my life on health, especially, you know, it is like really important now, especially with all the different challenges that's going on in the world, you know, various circumstances we're facing, various everything that's going on. You have COVID, you have, it looks like depression has accelerated, a big deal, you know. Right now it's even more important to be healthy, all around healthy, or at least try to be. This is going to be I have so much different type of health that I didn't even realize, as much as I take such a big deal on health. You know, there is so much different parts of it that makes up, you know, your whole survival, your body, your well-being. So today I'm going to start to concentrate basically, of course, on physical health and vitamins. And I'm a person like this. I used to be like, you see that vitamin is good for you. If they say vitamin C is good for you, and even though I'm taking a multivitamin, I'll start taking extra vitamin C. We all know vitamin C is good. I have some notes here that I jotted down for now. And we all know that vitamin C is good for your immune system. The big deal, you know, support of the brain health, you know, support of your immune system, basically the ability to fight diseases. We all know that because there's so much people out there talking about health and wealth. Okay. The benefit, you know, of vitamin C is like the big deal. It also helps to other medications to absorb. I made a lot of notes on different supplements. So I jot down some notes of vitamin C, vitamin D, the ones that I'm going to concentrate on today. There's, you know, all the different letters of vitamins. So for example, vitamin C, different vitamin D, we know vitamin D is responsible for your intestinal absorption of calcium, magnesium, phosphate, you know. You have vitamin C, which is antioxidant, which protects the skin, the body. It protects the skin from free radicals. You know, you need it to form red blood cell cartilage, muscle collagen, you know, strong bones, build your bones, vitals for healing process to the body, produces vitamin C as recommended. Magnesium supports the muscle nerve function and production of energy. Low levels usually doesn't cause symptoms. Chronically low magnesium, which I'm learning, chronically low magnesium is a risk of high blood pressure. So everyone know that I suffer from this strange blood pressure that no matter what medication the doctor gives me, it doesn't seem to have any effects. No, I'm going to get to that. I'm trying to think. I'm testing something. High blood pressure, heart, and decrease type 2 type 2 diabetes and osteoporosis. That's magnesium. That's what magnesium is good for. Zinc, you know, the body only needs a small amount of zinc. I was told during COVID you need, you know, the Z-Pack. You need zinc, vitamin D, vitamin C, magnesium. The zinc pack, and I was stocking up on all of them and taking multiple all day long during COVID and feeding these to my husband. And my husband was crying for some kind of ailments in his chest. I'm going to get to that probably in a later video also. But zinc, the body only needs a small amount. It is taken You know, it takes from mineral creation of DNA, growth cells, building protein, building tissue, supporting healthy immune system as well. So that's like a synopsis of vitamin D, which the most essential vitamin D you can get, you know, is from the sun. And with the sun, the best time to get vitamin D is between 10, I believe. I think they said it was 10 or 9 to 10:45. That's the best source of vitamin D, and you only need 15 to 20 minutes in the sun. You don't need to stay out there all day, because then you run the risk of overexposure. But vitamin D, you only need 15 to 20 minutes in the sun for vitamin D. I'm learning now, because I'm taking all of these vitamins, and even though I'm taking a multivitamin, because ever since I had my first child, I never stopped taking prenatal vitamins, which has everything. And I used to breastfeed, so I continue taking prenatal vitamins until today. And I'm always looking at the benefits of vitamin, but one thing I noticed people never looked at is the side effects. And I'm starting to learn that now, and I learned something interesting. Like, for example, vitamin C, too much vitamin C. Normally the body will excrete the vitamins that you don't need if you over indulge in taking vitamins, like I normally do. Too much vitamin C, I learned, caused heartburn, nausea, stomach cramps. I'm telling you, all of these, headaches, diarrhea, kidney stones. I didn't know that. So I was taking a multivitamin, then I was taking zinc, then I was taking elderberry, which has vitamin C, then I was taking magnesium with vitamin C, and then I was taking 1,000 milligrams of vitamin C by itself along with my diet. And I honestly get cramps. Even my husband was complaining of cramps in his stomach, cramp, and I never thought. And if I hear that, what I'll do is ramp up on the vitamins. So sometimes what I've learned is the same thing that causes good can also cause harm. Overindulging in everything is not good. If you overeat, is not good. If you undereat, is not good. The sun is good for you, but if you stay out in the sun too long, not good. Water is good for you, but they have something that you can drink too much water and actually drown yourself, drown your brain by drinking too much water. But I'm going to concentrate on vitamin C. Like I said, you higher doses and more can lead to side effects. You only need doses over like 2,000 milligrams a day may increase the risk of diarrhea and kidney stones. If you have a history of kidney stones, taking more than 1,000 milligrams a day may increase the chances of having more kidney stones. This is overindulging in vitamin C. I jot down these notes. Chronic kidney disease. Vitamin C can increase oxalate formation, lead to kidney failure. Large amounts of vitamin C in people with a metabolic disorder called glucose 6-phosphate dehydrogenase or G6PD. However, this is also uncommon. Iron overload. Vitamin C supplementation can exacerbate symptoms since it has a role in iron absorption. That's why they always tell you to always talk to your doctor or your healthcare provider before embarking on any journey of taking supplements, to ensure that the dosage that you're taking meet your individual needs or your overall health. For most healthy people, it is easy to get adequate amounts, enough vitamin C through your food. You can meet your recommendation dietary allowance for vitamin C each day with eating just one kiwi, red bell pepper. I don't know anybody that eats a whole red bell pepper, but you never know. A cup of tomato juice, orange, or a cup of strawberries. That is all you need for your daily recommended allowance of vitamin C. That is all you need. Now I was taking a multivitamin. I was taking an extra 1,000 milligrams. Then I would take magnesium with vitamin C. And then I would take iron with vitamin C and zinc with vitamin C. So I'm taking all of this because, especially during COVID, I want to ramp up my immune system. I want to make sure that anything enter my system, I can knock it out. Not realizing that I was giving myself an adverse effects for more health problems. The same thing with my husband. I was ramping him up, and he always complained, why do I have to take so much? Isn't there one pill that gives me everything? So I always ramp him up, take it because you work so hard. You know, he works for FedEx, so he's on the go. I mean, he's in and out of the truck 200 times a day, delivering, you know, these packages. And I'm like, okay, you need your strength, you need your help, you need to keep your immune system up. You know, it can be compromised because you work so hard and you're not eating properly, not knowing that ramping it up on all of these supplements does not, in fact, is going to cause the opposite of what I'm trying to do, which is stay healthy. So today we're going to dive in or talk a little bit on physical health. In the next video, I would like to talk about mental health, emotional health, you know, financial health. Depression nowadays is like rapid. It's running rampant all over the place. Financial health. Financial actually is, I think it's coming in so many different ways. It's not the go to college anymore. So we'll continue with that in another video. Today we'll stay on the supplements before we get off track with the financial. I made myself a few notes, you know, that I was actually blown away to see all of these results when I did the video or research on the side effects of vitamin C. The nausea, vomiting, diarrhea, stomach cramps. So you're taking supplements for your overall health, then you start having these side effects, not realizing is that you're overindulging in these vitamins. So now what we have to do is make sure that we're actually taking the correct amount of recommended daily allowances before we turn around and hurt ourselves trying to keep ourselves healthy. So we're trying to keep ourselves healthy and we're hurting ourselves. The recommended daily allowance for vitamin C for everyone, let's say for example, 0 to 6 months is 40 mg, which is 16,000 IU, which is 40 milligram. Like for our age, 7 to 12 is 50 milligram, 1 to 3 is 15 milligram, 4 to 8 is 25 milligram, 9 to 13 is 45 milligram, 14 to 18 is 65 milligram. That's females, 14 to 18. 14 to 18 males is 75 milligram. 14 to 18 during pregnancy is 80 milligram. 14 to 18 during breastfeeding is 115 milligram. 19 and over is 75 milligram, which is 3,000 IU. 19 and over, that was female. In male is 90 milligram. 19 and over during pregnancy is 85 milligram, and 19 and over in breastfeeding is 120 milligram. So if you're 14 to 18 and you're pregnant, it's 80 milligram. If you're 14 to 18 and you're breastfeeding, it's 115 milligram. If you're 19 and over and you're pregnant, it's 85 milligram. And you're 19 and over and breastfeeding is 120 milligram. That's vitamin C. It's also the tolerable upper intake level is the highest amount you can safely take. Doses beyond that are more likely to cause side effects. For vitamin C, the daily tolerable upper intake is different for different groups. Adults is 2,000 milligrams. Children 1 to 3 is less than 400 milligrams. 4 to 8 is less than 650 milligrams. 9 to 13 is less than 1,200 milligrams. 14 to 18 is less than 1,800 milligrams. The tolerable upper intake during pregnancy is the same as those for your age group. you can take the same amount as for your age group. So I'm just stopping by today to say we're gonna stick on vitamin C, that just because something is good for you, you also have to be careful and how you ingest it. You have to be careful on the amount. You have to be careful on your overall health, because you could be trying so much to keep yourself healthy and hurting yourself in the end, not realizing that you're doing yourself more harm than good. And I'm a perfect example. My husband will tell you, if I think this is good for me, I will just start eating and eating and eating and eating, not realizing. So just because something is good for you, be careful that you're taking the right dosage for yourself at that situation, or for your body, or for your situation, or for your health needs. Because trying to stay healthy, you can hurt yourself in the progress. And I'm learning this. I'm a reader, so I'll back in the day, I'll just take vitamins a lot. I'll eat, but I'll take vitamins, and I'll eat every vegetables there is out there, because I'm a vegetable and fruit person. I'm not necessarily a meat person. I like vegetables and fruit. So I'll eat, and I'll eat vegetables and fruit. I ate so much fruits till now my teeth are so sensitive because of the tart and the acid on the enamel of my teeth. They are so sensitive now. It's very hard for me to eat a bowl of fruit and brush my teeth. The sensitivity, I don't even know how to explain the sensation. So I'm just stopping by for a quick, advice, so to speak, that we're trying to keep ourselves healthy, but we could hurt ourselves in the interim. So make sure what we're doing is actually good for us. Make sure we're taking the correct amounts. Make sure we're not overindulging. Make sure we're not overdosing, because you can't overdose on vitamins. I mean, look at this. You take vitamin C. Everybody's like, vitamin C, vitamin C, vitamin C. It's great antioxidant. It's great for free radicals, but you have to take the right amount. Also, if you're on prescribed medication, something that you have to take daily, you have to see what is the interactions with vitamins, because vitamins can also has an adverse reaction to your medication. Vitamins will also knock out the effects of your medication, and then you are not actually getting the benefits of the medication that you need. Taking vitamin C with certain supplements, you have to research. If you're like me and you like to take different supplements and vitamins, you have to research to see what is the adverse reaction with your medication. Because, for example, with blood pressure pills, there's various adverse reactions with things like zinc. If you're on cholesterol medication, if you're on heart medication, if you're on medications for diabetes, you have to research and make sure the supplements that you're taking trying to stay healthy isn't doing you more harm than good with the supplements that you should be taking, with the medications that you should be taking. And the whole aspects that we're trying to get to is get off these medications that are not natural. Get off of the synthetic medications, and we try to stay healthy by exercising. We need exercise actually, along with the vitamins. We work to get off the medication. Some of them you cannot help, and you take the ones that you need. Don't come off the medication saying you're going to take all natural. All natural is good, but make sure it is good for your situation. What you want to do is wean yourself. Take the medication that the doctor orders. Exercise, eat right, and work to wean yourself or reduce the dose of the synthetic medication. Vitamins, when you're taking vitamins also, make sure they're natural. Make sure they're natural vitamins. I take hyaluronic acid, I take lysine, and I take iron. I slowed down on it for the past week to give my body a break, but most of the vitamins that I take is from Garden of Life. The Garden of Life raw vitamins. I can show you. Let's go get this for 1 minute. This is actually prenatal, and like I said, I've never stopped taking prenatal. And this is Garden of Life multivitamin. They have multivitamin. This is called Vitamin Code from the Garden of Life. And when I take the iron, I take the raw for Garden of Life iron with all natural ingredients, cranberries, all natural, actually real fruit vitamins with no additives. Of course, you're going to have probably ascorbic acid to keep it. But this is all natural Garden of Life vitamins. It's non-GMO. It's certified gluten-free. And I always make sure it has the non-GMO verified on. Every vitamin I take, I read what is the ingredients. And I read that it's natural source from natural products, natural garden products, natural fruit products, natural fruit ingredients instead of products ingredients. So you don't want to take vitamins that's all synthetic ingredients. You want to take vitamins with, because the whole point of taking the vitamin is because sometimes you're not getting enough in your food. So you take it where they compressed the actual food into the vitamins. Even with the smoothie that I make sure I take organic fruits, the frozen ones, because frozen is as good as fresh. Some canned foods, I deviate more to frozen than canned. It's just me, it's just your preference. But make sure that the vitamins you're taking is non-GMO. Read the ingredients thoroughly to see what is in it that you're actually taking, to see that it's actually doing you the good that you want it to do. This is my first video. I'm testing. You know, I'm all about health and wellness, always about health and wellness. I'm going to be posting a lot on the blog, on our on our website, which is barrettchronicles.com, and A New Dawn. It's called barrettchronicles.com, A New Dawn, because I believe there is always a new dawn. There's always hope over the horizon. There's always hope. There's always a new dawn and another step to go forward as long as you have life. So with that being said, we're starting with the vitamin supplements. We're concentrating on vitamin C, and we're concentrating on the amounts that we're taking, the dosage, the amounts that we're taking, to make sure it is actually right for us. My glasses is probably lean and I look like Lady in the Shoe, you know. And we have to be careful. Again, like I said, the side effects of vitamin C: heartburn, nausea, headaches, stomach cramps, diarrhea, kidney stones. And this is what you're thinking that will do. Like, for example, vitamin C, they will tell you it's not right for everyone. You know, you have to talk to your healthcare provider first. If you're going to vitamin, for example, if you're undergoing cancer treatment, vitamin C supplements can interact with the cancer therapy. I didn't know that. Again, if you have chronic kidney disease, vitamin C can increase the oxalate formation and lead to kidney failure. Now, you're taking vitamin C thinking it's building your immune system, when it can actually cause kidney failure. Iron overload. Vitamin supplements can exacerbate symptoms since it has a role in iron absorption. So you definitely always have to speak to your healthcare provider before taking any supplement to ensure that the supplement and dosage are appropriate. Seriously, that the supplement and dosage are appropriate for your individual needs and your overall health. So we're going to end it today with concentrating on vitamin C. I mean, we have all the letters to go through. So we're going to end it today. Today is like an introduction. And give me your comments. Tell me what you think. Tell me what you'd like me to talk about. Tell me if you have a rebut, if you have a contradiction. But I can guarantee you, these are all facts. I have researched for years, but I've never honestly researched the side effects. I'm always researching the benefits of this, the benefits of that, but never the side effects. So everything has a side effect. Everything has a side effect. So today we're going to end today's little short video blog We're going to be posting a lot on the Barry Chronicles website. We're building it now. It's out there published, but it's actually in, I guess you can call it construction mode. We're still building and testing and building and testing. But we have it out there just to get feedback. You can go on the BarrettChronicles.com website. It's BarrettChronicles.com, and then you'll pop up in Google and you see A New Dawn. That's us. And we still have our Yes Friends Barrett Chronicles. It's been hectic for a while. We're kind of reorganizing and trying to get the channel, up and running. Reorganizing, trying to figure out what we need to do, what we don't need to do to get the channel going, to get our subscribers going, to get our views going. So if you be so kind as to subscribe, share, and like, and comment. Every comment, good and bad, is needed. Thank you. I'll check back with you again, friends. Yes. Another video I'm going to try and make, probably 2 or 3 videos a week, because there is so much to do with health and wellness. Physical health, emotional health, mental health. Those 2 are super important. Emotional, mental health, and financial health. And we need physical, emotional, financial, and overall mental health to survive, because it is so much more important now than ever. Thank you, guys. I appreciate it. This was kind of nerve-wracking, but let's see how we go. We have a lot of improvement to do.